In this video, we discuss the use of desloratadine and loratadine during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Desloratadine, also known as Clarinex, is a popular antihistamine. In the US, Clarinex requires a prescription, but in much of the rest of the world, it does not. Just like another antihistamine, cimetidine, desloratadine has anti-cancer properties. However, whereas cimetidine inhibits the histamine 2 receptor, loratadine inhibits the histamine 1 receptor. Histamine, generally speaking, is inflammatory and associated with cancer growth. Desloratadine has also been shown to accumulate in cancer lysosomal membranes, eventually destabilizing them and contributing to cancer cell death. Unfortunately, there are no randomized controlled trials demonstrating a survival advantage for desloratadine use during cancer treatment, but retrospective analyses consistently demonstrate a benefit. One retrospective analysis of 1,557 people with metastatic cancer who used antihistamines were compared to 2,589 matched controls. Desloratadine was found to confer a 6% survival benefit. This then increased to 11% when loratadine was combined with chemotherapy. Although modest, these were advanced patients. A retrospective analysis of 395 people with all stages of melanoma found that desloratadine use was associated with a 55% improved chance of survival. Another retrospective analysis of 1,107 breast cancer patients, 58.7% of whom had stages 0, 2, found that desloratadine was associated with a 33% decrease in mortality. Another retrospective analysis found that cancer patients with low levels of histamine had a more than tripled response rate to anti-PD-1 immunotherapy compared with patients with high plasma histamine. One retrospective analysis of 8,269 cancer patients found that desloratadine conferred a survival benefit in every cancer, with the sole exception of non-Hodgkin lymphoma. The average survival benefit conferred by desloratadine was 21% with immunogenic cancers and only 4% with non-immunogenic cancers. Loratadine, also known as Claritin, is very similar to desloratadine and is over-the-counter in the US. Loratadine actually performs better in non-immunogenic cancers than desloratadine. It conferred a 3% survival advantage in immunogenic cancers and a 13% survival advantage in non-immunogenic cancers. Very few side effects and/or drug interactions are associated with both desloratadine or loratadine. Neither penetrates the brain particularly well. For more information, see Cancer Self-Defense 101, Quick Tips to Help You Survive.